When March 16th came and we all had to move things very dramatically from an in-person experience to a virtual experience, I was profoundly moved by how adaptable our families had become. The biggest challenges were just being patient with all of us as providers as we made that transition. And once we were available to them in a virtual forum, they were very receptive. They were also offering a lot of different ways we could reach them, different apps, different forms of technology. Their biggest challenges that we've seen, unfortunately, a lot of our suicide attempts have gone up, and those were primarily with folks that were already struggling with some pretty profound mental illness. And I'm not just talking about our system of care in general, I'm talking about our county. Our opioid overdoses have gone up dramatically as well. So when you contribute all the factors that COVID has brought to the table, isolation, financial stress, death of loved ones often, it is not surprising that these things have increased. But I think the resiliency of our families and how they bounced right into what we're doing now was pretty significant. There's the concept that through crisis there is opportunity, and I thoroughly believe that, and I think this is an example of that. A lot of our families had profound struggles with outside things that were going on in their child's life. For example, a lot of school issues, a lot of peer issues. When we were able to begin to isolate those things, get them out of the child's life, we were able to begin to isolate what were some of the most crucial issues, basically just eliminating more variables that were in the community. Therefore, it made it easier to begin to pinpoint what some of those true issues were, and we could target those issues and really help the families. I watched it, an amazing kind of efficiency I hadn't seen before. So in the isolation, there was an opportunity to really narrow down what true challenges were, as opposed to what some of the extraneous factors were that were contributing to that. And our families were incredibly receptive to trying new things because they too became aware, and I think maybe heard. Kids tell you all the time, it's my teacher's fault, or it's the bully at school. But until you remove those things and you see that the dynamic truly stops, I think they felt validated in a lot of ways. And I see that as a benefit. And it created a more efficient process that we were able to provide our families. When the pandemic first came, it was glaringly apparent to me that this was going to be a marathon and not a sprint. And for my own sense of self, I knew I needed to prepare myself and my family. I have a young child at home, and that we needed to buckle down. So I took that same premise and I brought it to my work, and I brought it to my colleagues, and I brought it to the families that we work with. That some people were going to fall quickly from the isolation and the fear, and some people were going to wear down more slowly, and we needed to be aware of all of those things. So I began to incorporate as much data as I could about what was going on locally and what was going on nationally, internationally, into the trainings I was doing. I took all of our trainings, which were live in person, and switched the format pretty quickly. And then I would always use the last half of the trainings to offer this data and give everybody a forum to talk about how they were feeling. And I'm still doing that. We are still in it. And just because it's starting to feel a little less crazy, I guess, the level of stress that we are under, this is like a war. This is long term. This is marathon. So I still do it. I do it with every training. Even when people seem to think they don't need it, they're surprised that they immediately start talking about it, and they're appreciative of the data. Johns Hopkins has a really good data map on stuff for the country, and I try to keep them as informed and give them a platform to talk about how they're feeling.